My name is Mitch, and I will be performing trach care. Here, you can see we have our trach kit. What you're going to want to do is open this away from you, like so. From here, we're gonna put on our sterile gloves. Make sure you do it away from the station so you don't knock anything over. Now that I have the gloves on, I'm gonna just move this over. I'm gonna set up my sterile field now. I'm gonna take the drape, undrape it, and set that down. Not gonna touch anywhere else. Now I'm going to empty the contents onto my sterile field. Here we have our wire brush for cleaning. Also for cleaning we have Q-tips. The kit comes with sterile water, a saline solution. We'll have our fenestrated gauze and just regular gauze too. With my non-dominant hand, I'm going to unscrew my saline solution, take this and pour it into my kit, filling all 3 chambers. With my non-dominant hand, I'm going to take off the mask and remove the inner cannula and put it in our sterile solution. Don't forget to put the oxygen back on. So, with my sterile hand, I'm going to grab my brush. Non-sterile hand, I'm going to grab only around the outside of the inner cannula. I'm going to go ahead and clean the inner cannula and inside, outside, and make sure I rinse it in the second solution box. Since I'm done cleaning now, I can just go ahead and leave the wire brush in the kit like that as I replace the inner cannula back into the patient. I'm gonna go ahead and with my non-sterile hand, I'm just gonna go ahead and remove the oxygen now. The sterile part is over and I'm gonna replace the inner cannula. Then I will also replace the oxygen back on. Now I have removed one side. I'm gonna keep one hand on the trach over here while I remove the dirty fenestrated gauze off of this and get rid of that. Okay, now with this Q-tip, before I start cleaning the site, I'm going to actually put it in the sterile water, moisten it up, and then approach. Now I have grabbed a Q-tip and I will be cleaning around the stoma site, the trach site, above and under, below. Oh. Get careful because your patient might cough or try to remove the trach. It is a little uncomfortable, so get under there, perfect. Done with that one. Now with your extra gauze, if there is extra secretions around, we can go ahead and clean the site. I have removed the mask, so I can clean around the mask too and then replace that there for after. With our new fenestrated gauze, we're gonna slip that back in, and then I'm gonna go ahead and reattach the other side while I unstrap the next side and fit that under. Make sure that when we restrap the patient, we want that to be super snug because you don't want them to accidentally cough and then cough out their trach and try to have to force that back in. Oh, your inner cannula came out here. That's right. Now we will perform trach suctioning care. First, what I'm going to do is I'm going to want to check the chart. I want to see the doctor's orders, see why we need a suction. We want to just make sure we know the indications for suctioning. Literally, if they need to get suctioned every few hours, we need to go ahead and do that for them. But if they don't need it, then we shouldn't suction just because. Also, we need to pay attention to the patient. If they say they need to be suctioned, we can suction them. All right, Alice, how are you doing today?
I'm doing good, and also need my suction.
Before I begin, I'm going to want to, make sure I check if she needs suction too. If just in case she doesn't say anything, I need to do an assessment. So first, I'll just go ahead and do some hand hygiene.
And make sure you get hand sanitizer on so you don't get the coronavirus.
All right, Alice, I'm gonna go ahead and put this on your finger. Can I have your finger? Okay, perfect. Let's just leave that on there. All right, Alice, I'm gonna check your breath sounds, okay? I'm gonna need to get under your shirt, is that okay? Okay. Now take a deep breath in. Oh yeah. One more. Okay, one more. Perfect. All right, I'm just gonna take your pulse. I'm really taking her breath sounds. And maybe the pulse too. Perfect. All right, I'm just gonna take that out. Yeah, it looks like you can use some suctioning, so we'll go ahead and start, okay? Here is my suction kit. Like the Trach Care kit, I'm going to open this away from me. Now, I'll prepare to put on the sterile gloves just like Trach Care. With our dominant hand, we're gonna get our trach catheter that comes in. You can see it's scored with numbers down alongside. And we're just gonna go ahead and wrap that up in our hand, like so. The kit does also come with its own saline holder. So we'll go ahead and set that up. And we should still have some saline left from our last Trach Care. If you saw me in my last video, we'll just go ahead and pour that in there. All right. Now with my non-dominant hand, I'm gonna go ahead and grab the tubing, suction tubing from behind, and I'm going to hook it up into the catheter, like so. When I'm ready, I'm going to go ahead and hold on the button over here and get ready. Not gonna press down on it, but now I wanna keep in mind that I wanna not go anywhere closer than an inch away from where I'm holding, just to be sanitary. First, I'll just go ahead and take off this oxygen. That's her indications for suctioning. As we go in, we want to make sure we go along, the inner airway, And so we're gonna go in. Since she is a tiny human, we don't wanna go in all the way. But I'll probably go down flush with the tracheal tubing. Thumbs up means we're good to go down. So I'm not gonna suction. The moment I press down, find the right spot, we're gonna suction, and then I'm gonna slowly pull out, like so.
That took a moment.
Then I can go ahead and put the oxygen mask back on. In between, when we wanna, if this gets kind of built up with secretions and gunk, we can go ahead and clean the inside out by putting it in our sterile saline and then suctioning that up. All right, Alice, I'm gonna just reassess. Let's just take a look to see how everything sounds. I'm gonna get under your shirt, okay? Take a deep breath in through your mouth. Now breathe out. Breathe out like you're making an O with your mouth. Oh, perfect, perfect. Hey, you sound great, you know? How do you feel, Alice? What, say that one more time?
I'm feeling good.
And that's how you suction. My name is Mitch, and I will we have our wire brush, Q-tips. Here is my trach kit. Not trach kit. It's a suction kit. Okay, redo that.